Hi, I'm Dr. Deborah Drabick. I am an associate professor at Temple University and I study behavior problems. And today I want to talk with you about attention deficit hyperactivity disorder. Used to be called attention deficit disorder, and since DSM-4 in 1994, we've been talking about the hyperactivity part of it. We know that kids usually will display this when they're in early elementary school. Everybody has problems with attention, with concentration, with, sustained attention, like sitting through something that's going to be long. It's normal. And what we want to figure out when we're trying to diagnose ADHD is whether somebody's challenges are different than what we see among other people in terms of typical developmental demands. So ADHD is defined by problems with inattention, concentration, losing things necessary for other activities, but also problems with interrupting, blurting things out, being impulsive. And as I mentioned, we usually see this once kids get into elementary school. Then children are learning, okay, this is what I need to do to get along in the classroom. I need to pay attention to the teacher. I need to get along with other kids. So children that have ADHD often have challenges in all the domains where we want them to be successful. They're having problems fighting with parents at home, family members. They are having trouble staying on task when they're in school. Academically, it's challenging for them. They're having trouble making friends. And that can lead to other kinds of disorders also. So children that have ADHD might appear oppositional. They're not getting along with other adults. And so they're in a position where they might get diagnosed with something like oppositional defiant disorder, as they're recognizing that what they're dealing with is different than other kids. They might become anxious because they're not doing well in school. They might become depressed because they're not making the friends they want to make. They might be rejected by peers, and as they get older, then they might have difficulty making friends, and that can lead to them associating with other kids who've been rejected, which might lead to conduct disorder or even substance use problems. So we really want to diagnose this early on, and it's important that we're finding whether these challenges are present in multiple settings. Parents will often say, my kid is not paying attention. We have to disentangle whether it's just the dynamic with the parent and child, or if in fact it is something that is pervasive and cuts across settings. Understanding the teacher's perspective is really important because teachers' responses are implicitly normed. They've been around a lot of kids. They know if this is something that's problematic or different than what we would expect for that developmental period. So in terms of assessment, a lot of times parents will go to pediatricians, fill out a checklist. That's really not sufficient in terms of diagnosing ADHD. What we're interested in is understanding whether there are problems with attention, concentration, planning, but also doing like a neuropsychological evaluation where we're looking at things like memory, learning, achievement, and other areas where we can figure out where a child's strengths are. So we need to know the strengths to augment any kinds of areas of challenges that the children might have. In terms of intervention, we know that with difficulties with attention, we want to keep things short when we're talking to kids. We don't want to have these kinds of challenges where we're arguing with them, that we're giving short, simple commands, things that are easy for the child to follow up on. We want to make sure that if they're in school, they can have maybe a report card where it's just really thinking about the different behaviors that we want them to be successful with. So even just catching them being good, not worrying so much about punishing or avoiding difficulties that they might be having. We want to have good communication between the parent and teacher. If the child does meet diagnostic criteria for ADHD, there's the possibility they can have an individualized educational plan, and that would be something that the teacher would be able to implement in the classroom. Maybe they would have an aide, maybe they would have extra support. Sometimes we're using things like untimed tests, but in the end, we want to help the child be as successful as possible. So in the classroom, it would be helpful for the teacher to understand the child's strengths, and with individualized educational plan, that's an opportunity where they can figure out, they might be good at visual memory, maybe not so good with verbal memory, so we want to present information in multiple ways. But the goal would be to break things down in a way that the child is able to manage them. We want to prevent these other kinds of problems down the road and give them tools to be successful. With ADHD, we often see problems with learning, and so we want to try to mitigate that or attenuate those issues. So getting the assessment early on, making recommendations that can help across multiple settings is very important.